Today, I'd like to talk about COVID and obesity. Now, according to the CDC, if you are obese, you have the highest risk of dying with COVID. Now, COVID is here to stay, and just like the flu or influenza, which has been around since 1919, these viruses never really go away. They constantly mutate, and we've recently seen an example of this with the emergence of the Delta variant. Very infectious and very capable of getting us very sick. Now, data released by the CDC, the Center for Disease Control, studied hospitalizations of COVID patients for the period of 1 year. And from March 2020 to March 2021, and during that time period, there were almost 5 million hospitalizations. That's 4,899,447. Now, 11% were hospitalized with COVID. And that's 540,667. So 540,667 people were hospitalized with COVID over that year period. And of those hospitalized with COVID, 94.9%, that's almost 95%, had at least one underlying medical condition. Now, underlying medical conditions are also referred to as comorbidities. And by far, the strongest comorbidity for death due to COVID was obesity. If you have COVID and are obese, you carry a 30% higher risk of dying from the disease. That's higher than diabetes, higher than hypertension, and higher than heart disease. Again, 94.9% of those hospitalized with COVID had at least one comorbidity. And the more underlying conditions that a person had, the higher the probability that you would not survive COVID. So if you have zero comorbidities, you have less than a 1% chance of dying with COVID. Now think about that for a moment. With no comorbidities, you have a chance of survival that's 99%. And we all know that the healthier you are, the better you can fight and survive. And this makes plenty of sense. About 2/3 of all of those who died with COVID had 6 or more comorbidities. We also know that here in Florida, 65% of all adults are at an unhealthy weight. And as I said earlier, if you are obese and have, for instance, diabetes, your chances of survival from COVID are even lower. And it gets lower with each additional condition. If you are at an unhealthy weight, you possess a 30% higher risk of dying with COVID, higher than any other condition, including forms of hypertension, diabetes, kidney disease, and high cholesterol. Now, the similarity with all of these conditions I just mentioned is that they're all diet related. The more underlying conditions a person had, the higher the risk of death from COVID. Now, vaccines, social distancing, and masks are all helpful precautions, so you might avoid the exposure to COVID, but that's not enough. We should be just as active in reducing the risks of serious complications and even deaths should we become infected. The link to the CDC report is below. I have 26 years of experience in successfully helping patients reduce the risk factors associated with diet-related medical conditions. Click the link to my website to find out how. Now, I like to use the term unhealthy weight interchangeable with obesity, and the majority of people I help who are at an unhealthy weight have other underlying medical conditions as well, many of whom begin the process of healthy weight loss, who do begin that process, find their comorbidities improve or disappear altogether. This is Dr. Lombardo.